Sorry about that. I need to get that fixed because I have some more videos I really want to show you. Okay, do you guys need a break or you okay?
No. You need a break.
I'm okay. I'm still discombobulated from driving to LA and coming back, but I'm okay. Okay. So, you commute from LA every day?
Yeah, I do.
Oh, wow. That's the height. Okay, now hiatal hernia. Again, keep in mind with hiatal hernia, and I had a nice video, but unfortunately I can't get it going. But this is when you have the diaphragm now. So if you just can kind of visualize your anatomy, going back to anatomy, you have your diaphragm. And what pierces through the diaphragm that you remember? That separates, that's between the thoracic and abdominal cavity. What pierces through the diaphragm? Well, what GI organ?
Oh, the stomach.
Not the stomach itself, because that's the problem. The esophagus. Okay, so very good. The esophagus. Keep in mind the esophagus travels through the thoracic cavity and to the abdominal cavity, just the tail end of it, but it pierces through the diaphragm. So this is what happens. The diaphragm now, where it's nice and tight, starts to weaken. And when it weakens, it causes now an opening right around that esophagus junction. Okay? So what happens here is that because it now weakens and causes this opening to be larger, this now puts the stomach at risk for now pushing up into that opening. Okay? That opening is called the hiatus. Did you guys remember that from anatomy? Okay. So keep in mind that the stomach will now push up through the hiatus. Now, obviously, if this happens, as you can imagine, that will definitely cause a person to have GERD, okay, and heartburn and all that good stuff. So, they say the risk here increases with age. Women are more at risk than men for some reason, okay. It could be because of pregnancy, yes. It could be because of pregnancy. Okay. Now, it can be life-threatening depending on how much of the stomach can push up into the esophagus, okay? Signs and symptoms here, similar to GERD, so they will have heartburn, chest pain, and dysphagia. Now, we have 3 different types, okay, of hiatal hernia, and I do want you to know the 3 different types. I usually test you guys on this. So, sliding hernia is the most common, and this is where you have just that portion of the stomach that's right near the esophageal junction that pushes up. So just a portion of the stomach near the gastroesophageal junction, that is the small little portion that pushes up. Then the paraesophageal hernia, which is called the rolling type. This is where you have the greater curvature of the stomach, which means this is a larger portion of the stomach. And if you were to take a look at this, it almost looks like a big bubble coming out of the esophagus. Okay, it's quite graphic. So this is a larger portion of the stomach that pushes up through that esophageal junction. Or through the hiatus, excuse me. And then mixed. So mixed is when you can have both right at the paraesophageal junction and the greater curvature. So I had a wonderful video. It's okay. So they're showing you here just the 2 different types. So here's normal. Okay, so there's a hiatus, very nice, intact there. And then when we talk about the sliding, which is the most common, so it's the portion of the stomach that's right near the esophagus, that will bulge up above the diaphragm. And then when we have the rolling, as you can see, it almost looks like a big bubble here, the pocket. And this is the larger portion, or the greater curvature, I should say, of the stomach, and that pushes up through that hiatus.
Do you have the name of the title of the video so we can watch it?
Yes, let me. And when we take our break, I was going to try to still show it to you. This video is really good for this one. The title of the video is How Sliding Hiatus Hernia Forms. How Sliding Hiatus Hernia Forms. And the author, or the person that posted, was Bupa Health. I think I'm pronouncing that right. B-U-P-A, Bupa Health. Okay. So, and I'll still try to show you the video, so don't worry. I'm going to get IT guy. Okay, so we're still sort of in the esophagus region. So now we have to talk about Mallory Weiss syndrome. With this syndrome, this is where the esophagus or the epithelium of the esophagus actually tears and bleeds. Okay, so this is tearing of the esophagus and bleeding that can occur. This can be from forceful and prolonged vomiting. So say, for example, if a person's suffering from maybe a C. diff or something and they're doing a lot of vomiting, or even if we're talking about a bulimic, okay, that is unfortunately suffering this, okay, because of just the forceful vomiting that's occurring. Okay. Now, other factors here can be excessive alcohol ingestion. Okay. So as you know, when you ingest large amounts of alcohol, not only will it cause issues with just an acid amount, but can also now cause vomiting and too much vomiting, you know, from that. Coughing, believe it or not, coughing can also cause this issue. Okay, so sometimes people think, oh, you know, they have a cough, but coughing can cause an issue with the esophagus, okay, because of the amount of strain that's occurring. And also people that cough a lot, just to, as a side note, they can have also a lot of back pain and chest pain, okay, that's associated with that act of coughing. Straining, trauma, esophagitis, all that good stuff. Okay. Now, esophageal varices, I usually don't talk about this that much, but what happens with esophageal varices, this is a complication from portal hypertension, usually in alcoholics or people that have cirrhosis of the liver. Very high mortality rate because of the fact that when there is such a hypertension at that area, it can cause the esophagus, or I should say that the vessels around that area to start to bleed. Okay. Variceal hemorrhage within 2 years of diagnosis. Okay. Now, gastritis, itis, inflammation of the stomach. Okay, so anytime a person ingests a material or any type of substance that will irritate the stomach, and that can be a number of things. But one thing they do highlight here is alcohol and aspirin. Why do you think alcohol and aspirin? Well, it thins the blood, but that's different. But what is it doing? It's something that you guys probably learned in anatomy about alcohol and aspirin. Say that again. Well, yes. So what will happen is alcohol and aspirin actually crosses over. It gets absorbed in the stomach. That's the only two products that get absorbed in the stomach, which means that if you have high amounts of alcohol and aspirin, and over time, it can, yes, wear down the GI wall, especially in the stomach, because of the fact that it does absorb those things. So it can also cause individuals to have ulcers. Okay, so not to jump the gun, but it can give you an ulcer because of that crossing over the GI wall. And alcohol and aspirin do not mix. Okay, and if you've ever had that experience, you know what I'm talking about. Okay, so you never want to take alcohol and aspirin because it will definitely cause extreme inflammation of the stomach. So, signs and symptoms here, they do have anorexia, especially if there is a lot of vomiting and so forth going on. Nausea, vomiting, postprandial discomfort, so after a person eats a meal, okay, it will be very uncomfortable. And hematemesis, which is vomiting of blood. Okay, hematemesis. Now, chronic gastritis, and let me tell you this now, and I've seen this in many, many NCLEX books. They say H. pylori is the most common cause for chronic gastritis. And so let me just help you out even further. Any issue with the stomach, whether it's a gastritis, and I think they also talk about peptic ulcers, and even gastric carcinoma, they say that H. pylori is the #1 cause for anything that has to do with the stomach. Okay, so this bacteria, H. pylori, is the culprit. Okay, now although there are other factors, but they do believe this is the most common situation.
What were those 3 diseases you named?
Oh, what did I say? Gastritis,
I'm sorry.
peptic ulcer, and, oh, it's here already?
Yeah.
Okay. Peptic ulcer and gastric carcinoma. Gastric carcinoma, thanks. And we're gonna go over those other diseases too in detail, so don't worry. Now, gastroenteritis, okay, what does this mean? This is just a fancy term for inflammation of the stomach and the intestines. And this is just our normal stomach bug, okay, what they call the flu virus, stomach flu, excuse me, the stomach flu, where your body will have now a sort of irritation, or this pathogen that is ingested will now sort of irritate the GI wall and cause all different types of symptoms. Most symptom that's associated with this, just to let you know, is vomiting and diarrhea, okay, or both, sometimes both. Signs and symptoms: diarrhea, as I just told you, abdominal discomfort, nausea, vomiting, fever, malaise. And the only thing to do is, and again, your body will do what it needs to do to get rid of it, okay, although there are medications that if it is a known bacterial infection, okay, they can give medications for that. But keep in mind, the body will definitely try to get rid of that bacteria. And so what will happen, again, people will have extreme diarrhea, extreme diarrhea, vomiting. And so the treatment here is definitely to replace fluids, okay, because there will be a lot of fluid loss. Peptic ulcer disease, here we go. Number 1, H. pylori. Okay, make sure you highlight that. Other causes of H. pylori, here we go again with stress. Okay, stress can also cause, peptic ulcer disease. Now, with peptic ulcer disease, and I believe I'm going to show you a picture in a second, this is a disease where, again, there is going to be now a breakdown in the lining, okay, of the GI wall. And especially here, we're talking about peptic, we're talking about the stomach. Okay, so if you remember the layers of the GI wall, just to kind of bring back from anatomy, you have your mucosa, submucosa, muscularis, and what's the last slide? Oh, what's on the next slide? Oh, thank you. Your mucosa, muscularis, and mucosa, submucosa, and muscularis layers, even though they have muscularis, mucosa there, and serosa. So keep in mind that now we're talking about eroding these layers, okay, and as you can see, and I do have a picture that I can show you that doesn't need sound, of ulcers, okay, so these ulcers can get actually very deep, as you can see, okay. Now let me just go back to the causes here. Stress, smoking, alcohol, spicy food, and they say sometimes this can be genetic, okay. But keep in mind that usually what happens, most of the times, it's a person's lifestyle. So if they're smoking a lot, smoking along with stress, okay, and eating a diet that's high where they're eating a diet that's high where they would have a high acid production in the stomach can cause this issue. So let me just show you what I have really quickly. Okay, this is an endoscope that was done on an individual that's showing you their 2 ulcers. So there's one,
Oh, wow.
and that's pretty deep. And then here's another one. This one's deeper and larger. Okay.
Okay.
Count it. Not to be graphic. Now, let me walk you through the physiology of what happens with ulcers. So say, for example, it starts to break this mucosal layer, okay? keep in mind that on that mucosal layer, they're not showing you this, but this is where we have that alkaline portion, okay? So that alkaline layer is sitting right on that mucosal layer. So if we have an ulcer that's actually breaking down and it's penetrating deep and breaking into the mucosal layer and all the way down to the muscularis, now we have no alkaline layer. So which means that we don't have that protection that the stomach is supposed to have. Which means if you lacking that protection, what's going to happen is the acid that's sitting there is now going to cause more erosion. Okay, so this is the issue here with that. That's what that slide is explaining. Okay, and that's a picture there, but I showed you a video instead. Now, sometimes people can have a duodenal ulcer, so this can now extend down into the small intestines. And what happens when this now pushes down or extends into the small intestines, they say with the intestines will actually start to release hydrochloric acid where it normally doesn't. So when it starts to release this hydrochloric acid, this now causes a more acidic environment, which now causes more erosion. Okay, and they're trying to show you a picture. Those pictures are crap. Now, peptic ulcers, and that's the treatment, but I apologize, it's missing signs and symptoms. So let me give you the signs and symptoms of peptic ulcer. The signs and symptoms of peptic ulcer we have is epigastric burning pain. I'm sorry. Epigastric burning pain. Usually relieved by food. Usually relieved by food, especially dairy. Okay, so usually relieved by food, especially dairy. And why do you think dairy? So what does dairy kind of do?
It kind of coats
It does a coating. So the dairy has that sort of similar coating as that alkaline layer. Okay. Hence the reason why one of the treatments would be Tums, milk of magnesia, okay, those things, because it will sort of give that sort of protected layer. Okay. Now, these patients also usually have more pain on an empty stomach. So they have more pain on an empty stomach. The other signs and symptoms include nausea, upset stomach, yes, upset stomach, sound like the commercial, chest pain, and they could have a late finding of GI bleeding. Okay, so they could have a late finding of GI bleeding. And the GI bleeding, obviously, if it gets very deep. Okay. Now, treatment, antibiotics, okay, because they do believe that H. pylori is one of the main causes here, so they will give them that as a treatment. We have H2 agonists and proton pump inhibitors. What do you think they're going to do? What is a proton pump inhibitor and the H2 antagonist going to do? Very good. To decrease acid production. Okay, that's only there. Those drugs are given to decrease the acid production that is occurring in the stomach. Sulfate, excuse me, forms protective coating over that mucosa, so it will give that alkaline layer. Tell them to stop smoking because that also produces more acid production, and to avoid all of those other acid things such as the aspirin and caffeine and so forth. So that is the treatment there. That was that. So that's a picture they're just showing you H. pylori and how it gets in. Okay, let me take a break if you don't mind, and then we'll pick back up with ulcerative colitis. Can you just turn that off?
Hi, honey. Are you? What?